Good afternoon, everybody. Thank you for joining us for today's Leukemia Care webinar. Today we're talking about and discussing the emotional and psychological experiences you might be experiencing either during diagnosis, following diagnosis, living with your condition, through treatment, post-treatment. And we have a very experienced panel joining us today, and I'm sure the panelists will soon make themselves seen. In the meantime, a little bit of housekeeping, just to let everybody know. Unfortunately, people can't post questions vocally or visually or live. If you have any questions at all that you'd like to share with us during the webinar, please post them into the chat box and we will pick them up and come to your questions during the discussion. And also welcome everybody, not just here in Zoom, but welcome everybody that's watching us on Facebook. Similarly, if you post any questions or burning questions you might have or something you'd like to share, if you could post it in comments below the video on Facebook, my colleague who's helping organise things in the back end will pick your questions up and get them to me so that we can also address those in discussions. But again, not sure how many questions we'll have. We'll do our best to reach everybody. So from a process point of view, having introduced the topic, it's my great pleasure to introduce our panelists. Jasmine, are you with us? That's great. Perhaps a good idea is if I introduce myself first. Yeah, always a good idea. Those who haven't met me before, I'm Nick York. I'm actually also a patient. I live with a chronic condition, chronic lymphocytic leukemia, and I work for Leukemia Care in the advocacy department as the patient advocacy healthcare liaison officer. So again, thank you everybody for joining us here today. Special thanks to our panelists who I'll hand over to you one by one to introduce yourselves. And maybe I could start with you, Kirsty.
Hi, I'm Kirsty. I'm a haematology advanced clinical practitioner at the Great Western Hospital in Swindon. Prior to that, though, I have been a nurse for the last 20 odd years in haematology.
Thank you, Kirsty. Jasmine.
Hi, I'm Jasmine Hebden. I worked as a haematology clinical nurse specialist for over 20 years in Swindon, Great Western Hospital in Swindon. And I realised how important the psychological support was for patients. And so I retrained as a counsellor about 8 years ago and worked doing both nursing and counselling. And then last November moved all over to counselling within the psychology team at the Great Western Hospital.
Thank you, Jasmine. It's a pleasure to have you with us today and your wealth of experience. So I'm really looking forward to the discussion. Samantha.
Hello, I'm Sam, and I was diagnosed with acute myeloid leukemia in April 2016, and then I had a stem cell transplant in August 2016. I've been volunteering for Leukemia Care for nearly 3 years now because I want to give back. I want to try and make the patient journey a little bit easier. I also volunteer for another charity called Wigs for Heroes, and I facilitate meetings with them. All kinds of cancer types come to these meetings. I've learned quite a lot about different cancers, and we're basically there to listen and support and guide and signpost, and I thoroughly enjoy it. But yeah, it's interesting to hear about other people's perspectives of what they need in terms of support when they're diagnosed.
Thank you, Sam, and thank you for all of the work you've been doing for the last 3 years and where you've taken it to. We really do value your input, and it's great to hear from other patients as well, how they've coped. And for those on the call that are newly diagnosed, that you know, things do get better, things do change. And I'm hoping that today's webinar will actually help everybody feel a bit more empowered and able to deal with what you might be going through at the moment. And last but not least, Sophie, please introduce yourself.
Thanks, Nick. Hi, everyone. I'm Sophie. I was diagnosed with acute lymphoblastic leukemia coming up to 4 years ago now, when I turned 20. Much like Sam, I also had to have a stem cell transplant, but unfortunately I relapsed after that. So I then had to go through a treatment called CAR-T therapy, which thankfully did the trick. And again, much like Sam, I, as a patient, really wanted to do something to give back. So after I'd completed my studies at uni, I applied for a job with Leukemia Care, and now I am their advocacy officer. So it's really good to be here today with such a lovely panel.
Sophie, it's great having you with us and with Leukemia Care, and as advocacy officer there to help people in situations who may be on the call today, newly diagnosed or living with challenges, that you're one of the first points of call that people will reach when you reach out. So please do. Just so that we haven't scared the pants off of you, because obviously Samantha and Sophie have had acute conditions and had to go pretty quickly into treatment, and but diagnosis experiences are fairly similar across the conditions. I can allude that I live with a chronic condition, as I did earlier, and I was diagnosed some 12 or 13 years ago, and I continue today to live a perfectly normal life, and I, in a similar way, stepped up wanting to pass things forward into advocacy, and I'm currently on a second treatment. And so just wanted to share that if you're diagnosed with a chronic condition, that it's not something that might rush you straight into treatment. I think in terms of order of proceedings, Jasmine's going to give a little overview talk to explain to everybody the types of feelings and emotions and psychological challenges you might be experiencing at different stages in your journey, and why. Yeah, and I think Kirsty's going to then maybe jump in off the back end of that to add in any further observations that she might have in that area, which you might find helpful, because that will help sort of set the scene to explain what we're feeling at different times in our pathway. And Sophie and Sam have also kindly offered to also share the experiences, what they experience in those departments, emotionally and psychologically, at diagnosis. So that will just sort of help us set a little bit of the scene about what we're talking about. And then what we'll do is we'll follow then with a relaxed discussion, answering your questions. So please do post them in the chat. Any questions, anything you've got that's burning that you want answering, post it in the chat. There's no such thing as a silly question. And we'll have a discussion afterwards answering your questions. Plus, we've also collected some questions as well from previous patients who've written in and who've registered. So on that note, Jasmine, looking forward to hearing what you've got to say. Please proceed and explain.
Okay, so I'm going to focus on some of the feelings around diagnosis. When we talk about sort of talking about normal feelings, it doesn't mean that they are not painful or difficult feelings, but it's trying to sort of explain that some of those feelings a lot of other people feel as well, and that some of those feelings will pass. So when I talk about normalizing them, I'm not trying to say that they're not painful. The way I sort of think of it is that if you had a physical pain, you would want to do something about it. You would want some painkillers, or you'd want to know the source of the pain. And that's the same with feelings. It's about trying to understand what you're feeling and thinking about what you can do about it. So what a lot of people experience when they're first diagnosed is often a real shock. So particularly like we've talked about with acute leukemias, often it's really sudden. The diagnosis, some people may not have had very many symptoms at all, and then suddenly are given this really shocking diagnosis. So that can bring up a lot of sort of panicky feelings and a lot of feelings of shock. Whereas sometimes for other people, if they've had a more slow sort of progression to diagnosis, it may not be quite as much of a shock, but may bring up different feelings. The way I sort of think about that shock is, if we think about Paul Gilbert's work, he looks at the emotional regulation system. And he talks about these sort of three systems. We've got the threat system, the drive system, and the soothing system. And normally when we're feeling reasonably balanced, these three systems are in sort of balance, in proportion. But with a huge shock, like a leukemia diagnosis, the threat system, that sort of fight and flight kind of feeling, goes into overdrive. And that's what leads to those feelings of sort of panic. Could be quite physical symptoms, could be feeling that your heart's beating really fast, butterflies in the tummy, you know, real feelings of shock. And sometimes that's very, very difficult at the point of a diagnosis, because you may have a lot of physical symptoms as well. So working out what's what can be quite difficult. So those feelings are quite normal, and those would usually over time start to alleviate as more is understood about what the treatment's going to be and that sort of thing. A lot of other feelings are low mood. Sometimes people feel and report that they feel very sad, they feel very low, and that's really understandable. That's, you know, resulting from the shock and the sadness that this has happened. Often people sort of say that they'd thought of a cancer diagnosis as being something that happened to other people, and that sort of feeling that the sadness that it's happened to oneself can be really hard and lead to lots of feelings of sadness. A lot of people tell me that they feel quite isolated with it, that sort of feeling that the rest of the world is going on around somebody, and that feeling of feeling quite alone with the diagnosis. So hopefully as we go through, we'll be able to talk about some of the things that will help with these feelings. But at the moment, I just wanted to sort of highlight the type of things that you may be experiencing. Sometimes there's quite a lot of confusion and uncertainty at the beginning. So to get to the point of diagnosis, the doctors and nurses might have said, this is looking like a leukemia. We're not sure if it's leukemia, what type of leukemia it is. There's often quite a lot of uncertainty to start with. And then even uncertainty about what treatments are going to be. It's about looking for the right treatments for the individual. And so there can be a lot of uncertainty which arises from the condition itself and from the process to diagnosis, but also uncertainty about what does this mean? What does it mean in terms of life? You know, all those thoughts will come in, you know, will I be able to go to work next week? Will I be able to go to work in 6 months? You know, what is life going to look like? So a lot of uncertainty around the impact of the illness. I think most people would say that a diagnosis of leukemia, initially at least, makes them feel quite vulnerable. So, you know, a lot of people say to me, you know, I've always been really strong. I've always looked after everybody else. And suddenly there's that need for needing help, needing treatment. And that can bring up quite a sort of vulnerable feelings, which can be very uncomfortable. Another reaction which can be quite difficult is anger. It's completely understandable to feel very angry. This is not anything that's been done to you or done by you, but it's something that's happened, and why me are all kind of completely normal reactions. And also angry, sometimes people say, you know, I see all these horrible people out there and there's nothing wrong with them, and, you know, all sorts of different emotions. And sometimes that anger can be quite difficult to deal with for yourself and your families, but it's understanding that's all part of the reactions. Sometimes describe it like a grief reaction, grieving what you thought was certainty. You thought that life was a certain way, and suddenly this has happened and has thrown everything off kilter, and it's kind of grieving that certainty that you thought was there. So we've talked about sort of normalizing those feelings. And I think it's also understanding that you may not feel that you want to be positive. Everybody will be saying, or not everybody, but people might be saying, be positive, you're a soldier, be brave, all of these kind of things. And it kind of might be trying to make sense of that, kind of what does being positive even mean? I worked for many, many years with a wonderful haematologist, and he was trying to make that easier for patients. He used to say, what I think being positive is taking the information that you're being given, breaking it down into sort of understandable chunks, dealing with what you've got to deal with as you go along, not being afraid to ask questions, and most importantly, reporting symptoms that you might have, not sort of struggling with them on your own, sort of feeling that you can ask for help. And sometimes people found that was quite useful, that it didn't mean this sort of mythical thing of sort of saying I'm going to be fine all the time, because I think accepting feelings and noticing what you're feeling and being real about them is part of being positive. It doesn't mean, I believe, that you have to be cheerful all the time, because that's not possible. And that sometimes feeling sad or angry, those are all normal things which you will work through, and they will pass, and you're not going to feel like that all the time. I often say to people that I think the uncertainty at the beginning is one of the hardest times, of trying to get to that point of knowing what's going to happen next, what the treatment's going to be, and that kind of thing. Because once you've got a bit of a plan, then there's a little bit more clarity to things. So I don't know if that is sort of feels like a bit of an overview of some of the feelings.
Thank you, Jasmine. I think you really have captured it as well, and sort of tried to compartmentalize some of those into the different types of feelings and why, and what you're going to experience or what's okay to experience. I'm just wondering, Kirsty, we'd really look to explore all of this in the discussion with the questions we have, but I'm just wondering, Kirsty, have you got anything you'd like to add from a clinical nurse specialist ANP perspective?
I feel as though I was nodding like the Churchill dog there in the background with all of that. And I've always said, regardless of how long that I've done this for, that even if it was me, I don't know how I would process and cope, because this is something where I definitely agree it's a grieving process, and it's not a linear process. It's not something that as soon as you get the news that it just you start to process it. It's backwards and forwards, and there are days where you feel like you can cope with it. I say to patients that you'll have duvet days, and the days are where we have them normally under normal circumstances, but it's days where you just do not want to climb out from underneath your duvet, and that's okay, that's allowed. And I want to know about the ones where it continues and that duvet is getting heavier and it's a week before you want to appear from underneath your duvet. And I think this is one of the biggest changes that I've seen in haematology nursing, and probably my most favourite change is the fact that we have the Jasmines in the world, that we're actually now acknowledging that you can't separate your body and your head. We have to treat everything. We can't just treat this diagnosis. We have to treat the whole you, and we're all different. We have different hair colour, different eye colour. So we're going to respond to a diagnosis in a different way. And as healthcare professionals, we're not there. We're definitely not there. We've still loads of room for improvement, but we're understanding it better. And we're understanding that you can't cut off the head and deal with the physical. It's all together. And that loss of control is a big thing. This is not how you had planned for your life to be. And that's a grieving process, and that's going to go on regardless of how well you get on, because this was not in your grand plan. And this is in nobody's grand plan. And it's been able to, how do we fit this so that you can then take back some of that control eventually? And it's not an easy thing to do, and I don't think it's easy. And that's why I love the fact that we are making this normal, so that people talk about it, so that we can do a dual approach. We can treat this in this way, but we also have to treat how we're feeling as well, and allow people to have that space to be comfortable about talking to it and saying that actually, yeah, I can deal with the physical, but the mental bit is I'm really going to struggle with. And I know I would struggle with that side of things. I know that if I had to go into the ward for any period of time, Jasmine would probably have to sit with me 24/7. And it's just how then do we allow patients to express that, and then how do we support it? So, I could go on forever.
Kirsty, thanks for sharing that. I think that's really important observation, because all too often patients will be looking towards the physical observations and not being able to pick up what's happening with mood and emotion and all of that comes with it. And it's not just at one point in time, isn't it? The journey involves different stages, both in how you're managed and how your condition is managed and how you have to adjust to that. So it really is a mixed bag. And it's really great to hear that our care teams now are very much focusing on sort of the holistic care and especially the mindset of people. So that's really useful. We've got a bag of questions. You've addressed some of them already. So hopefully with my one good eye that I'll be good enough to make sure I pick the right ones out. But I think probably a really good exercise, which would be, if I could ask Sophie and Samantha, if you might be able to share, if you don't mind, what you can. Don't want to drag things up that you might not want to, but let's start around diagnosis, because I think the theme of this webinar was initially pointed towards that, although we are going to look at the ongoing journey. Maybe I could ask you first, Sophie. How did you experience diagnosis and the first stages of the process of being diagnosed emotionally?
Yeah, so for me, everything was a bit of a shock. Like there was no indication to me that it could be leukemia at all. And I just remember I'd been admitted to hospital with suspected meningitis because I was a student, and my only symptoms were headaches and a bit of a sore neck. And my GP was just a bit like, I don't really know what's going on. And I just remember I was sent into hospital. I was petrified of needles. I was, I'd only freshly turned 20. I was just, I was still so young. And I just remember waiting after I'd had a biopsy. I didn't even realise that it was a bone marrow biopsy. Had no idea what they were looking for. And I just remember waiting on the haematology ward. Again, about 4 out of the 5 ladies in there all had leukemia. It just went over my head. And I don't know whether that was sort of like a protective mechanism that my brain was, making me feel like trying to like block that part out. And I'll just never forget the nurse staring at me from across the room. And I thought, what is she looking at? Like, why is she staring at me? I was on my own. I was waiting for my parents to come. And I just remember getting up and going over to her and going, well, what's going on? And she was like, oh, the doctor wants to see you and this, that, and the other. And I was like, okay, then that's fine. Like, I can see him. It's fine. Just completely not realising that she was trying to drag it out until my parents got there. And I went and sat back down and I went on my phone and Googled symptoms of leukemia. I just did it and I looked at it, went through the list and thought, nah, I haven't got any of those. And so then when I was taken into that room 20 minutes later and told, it's like, what the hell? Like, it almost felt as though everything came crashing down around me. And it was like from that moment, like the trajectory of my life like changed completely. And I really resonate with that idea of the grieving of your past self, because it's true. It's you're never going to know what your life would have been like if that hadn't have happened. And for me, it was I was speaking to Sam about this yesterday. We had very different reactions to our diagnosis. So my reaction was immediately to basically burst into tears, and the first thing I did say was, what about my hair and things like that? And they were just like they didn't really know what to say to me, and it was just really difficult. And I don't know, I think there's a way to be diagnosed, and the way that I was diagnosed, I don't feel like it was it. So I was told, and they kind of just sent me back to my bed and closed the curtains around me. And the bless her, the lady next to me, she'd come around the curtain and just hugged me because she said, I've just heard what they've said, and you know, it was just awful. And it's just how do you start to process that? Like, you've had no preparation at all. It's crazy. And I'm a big believer in, you know, everyone's diagnosis. I feel like it's a massive contributor to how you look at your illness and going forward, especially in those, you know, first few weeks. It's really important. Like, you need like a stable situation to get you through it. And if you aren't diagnosed in the best way, then it really puts things off to a rocky start.
Thanks, Sophie, for sharing that. It's not something you've shared with me before, actually, and it sounds like your diagnosis, the actual moment, was very isolating. So I was really glad for you that there was somebody there, you know, to put their arms around you. And the shock must have been immense. And, you know, that's what Jasmine was just talking about. Maybe we can move on after Samantha has shared her experiences as well, as to looking at how we overcome some of these, or how people can overcome them, or experience of overcoming and going through some of these phases. But Samantha, I think we all.
Do you want to go to Kirsty first, because she's got her hand up?
Oh, Kirsty, apologies.
That's okay. I
had half of my screen covered. This is trying to multitask.
Don't worry. I really just wanted to say, I think, and it's not in defence of healthcare, but there is no easy way to sugarcoat a leukemia diagnosis, and it's never going to be a good diagnosis. And having done this for years, I think when we know somebody has a leukemia, regardless of whether it's an acute or a chronic, you're so acutely aware of how that is going to impact on them. And there's never an ideal situation and an ideal way of doing it. And I think sometimes that's the real hard bit. It's then we can never make the diagnosis better. We struggle to speed it up as well in haematology, just because of all the techniques we do. But I think it's that trying to be able to move on from that diagnosis and then make the next bits nice, and saying, this is your diagnosis and then here's what we'll do about it. But it's been able to go in almost prepared to say, here's the bad bit, here's the diagnosis, the life changing, and then almost a little bit of a plan, but be there with those hugs as well. And that's a big part of our role, is just be, we can't change this, we can't make this better, but allow you that space to cry, and allow you that devastation and that regret. It's a bit of a regression. I would be crying. I mean, I would be, what will I do with my hair? So it's allowing that, and saying, as we said earlier, it's that being able to do that, just being able to have that cry to then say, how do I then start processing this?
Thank you, Kirsty. Very valid. And perhaps I was guilty of trying to move on to those stages by preempting them before talking to Sam, but really important observations. And it's got to be hard from your perspective, having to share that news with people. How do you sugarcoat, how do you sugarcoat the pill for yourself sometimes?
You don't. And I guess this is something that we can pick up on later, is just that one of the big reflections for me was COVID, and the fact that, Sophie, if you had been in our ward during COVID, you would have had nobody there. There was nobody. So people were getting this life-changing diagnosis with nobody there. And that broke my heart. That broke me. That was the worst part about COVID, was that we were standing back with masks and gloves, and you just couldn't even go and comfort somebody the way that they needed to. And that's the thing that I've taken from COVID, is that people need to have people around them. They need that support mechanism there, even if it's friends, even if it's a healthcare professional, because there is nobody. They need somebody there at a diagnosis just to help start that process.
Thank you. Kirsty, it's glad to see that things are changing now, and people aren't left in that situation at the moment. Mindful of time, we've definitely got all of these topics noted down there, and I think support networks and coping is a big part of what we're going to discuss. Samantha, please would you share with us what happened to you and how you felt?
I will. I was admitted to hospital after a blood test at the doctor's. I hadn't been feeling very well, had a blood test. Within 24 hours, I had a phone call from the hospital, asked me to go up to The haematology ward at my local hospital asked for a specific doctor. They just told me that, you know, I had low white cells and that I was severely anemic and all, but nothing else, obviously, over the phone. So I had a bit of a cry at that point because I just thought, what's going on? Made my way up to the hospital, told them who I was, and then all of a sudden I was just surrounded by people wanting to poke and prod me and ask me a million questions, and you know, all kinds of things were going on, and I had no idea why I was there really. I knew I was going to have a bone marrow biopsy later in the day. I had MRIs, chest x-rays, CT scans, I had everything that day. So because I felt okay after I'd done all of that, I just said, oh, well, can I go home? Because, you know, this is a hospital bed that could be used for a really ill person. And I'm fine. I don't need to be here. So, you know, can I go home? And I kept saying it to every person that came through the door. You know, I shouldn't be here. I'm a fraud. I'm fine. And one of the CNSs came to see me and she said, we can't let you go home because you have no immune system. And, you know, you could potentially pick up an infection and it could be fatal. The best case scenario for you is that you could have a very, very nasty virus, or you could have leukemia or lymphoma. So I didn't hear leukemia and lymphoma. I just heard a very nasty virus. So I just clung on to that and thought, you know, some super duper antibiotics, I'll be fine. I'll be out of here in a couple of days. I'll be fine. And then the consultant came to see me and she pulled the curtains round, which is never a good indicator. And she just said, basically, you have either leukemia or lymphoma or a crossover of the two. And at the moment, because we don't know, because it's not definitive, any of the tests that we've done today, that they weren't definitive, we've had to send your bloods and all your samples away, and we won't know for 48 hours. So I was like, right, okay, what happens now? And she said, you stay here until, you know, your official diagnosis on Thursday, it's a Tuesday. You'll need to get your children here because I've got 3 children. So I was like, right, okay. She says, but you're going to have to be monitored. So I stayed, and I was on my own when I had that diagnosis. I was by myself, and it wasn't COVID. I was by myself. Okay. So I just sat there. I was in a room with another lady who had a chronic leukemia. And I sat there and I cried, and I'm not really a crier, but I sat there and I cried. And then I got myself together and I thought, right, okay, my children are coming in. So I need to deliver this news and make it as positive for them as I possibly can. So anyone who knows me knows that I'm a bit of a joker. I laugh a lot, smile a lot. I'm a bit silly. That's who I am. So I made a joke out of everything, literally everything. So they came through the door and I sat them down and I said, look, kids, this is what we're dealing with. We'll know for definite in a couple of days, but you know, I'm going to be fine because I'm the strong one. I'm the fixer. You know, I do everything for everybody else and make sure that everybody else is okay. Put myself on the back burner massively. I was like, right, I've got to get through this because I need to get home to my kids. And that was basically how I felt. Inwardly, I was terrified. I was absolutely terrified because I just thought, I can't leave them. I can't leave them. You know, they're on their own and I can't leave them. I was angry with myself for not acting quicker because I knew that I wasn't very well. I didn't think it was that bad, granted, but I knew I wasn't very well. So I was angry with myself because I hadn't acted quicker. And I dealt with all of my emotions privately, all of them. You know, whenever anyone spoke to me about it, whenever I went home, I had 4 days at home, and I made all of the phone calls. And I was speaking to my dad was great. He was just like, you've got this, Tiger, you'll be fine. You'll be fine. I know you, you're not going to take this lying down. But lots of people cried. And the way that I dealt with it is nobody cries around me. You don't come into my room and cry. You don't come in and express your emotions to me. This is a happy, positive place. This is peaceful. This is calm. I don't want to deal with your emotions, basically. That's how I dealt with it. And I think it was because I was a mum. And my first thought was my children and putting my children first. And, you know, I'm sure that resonates with most parents. So it was very, very difficult because that caught up with me eventually. I was strong for too long, and I tried to make it better for everybody else all the time. And by the end of it, I was completely beside myself on the floor, crying. I can't do this anymore. So I wish I'd dealt with it at the beginning, and I put myself first because my consultant told me to do that. She told me to put myself first, and I didn't do that. So if I was to give anyone advice, I would say feel the feelings when they come and allow yourself to feel that emotion, because it's okay. It's okay to do that. Don't do what I did. So yeah, that's me.
Well, Sam, thank you. I think there's a theme. I didn't ask, I don't know if I picked it up, Sophie, were you pretty much admitted immediately after your diagnosis?
Yes, I was. So when I was told, I was also told on my own, Sam. So I just had 2 doctors and a nurse next to me, and my parents weren't there. And they said to me, what we're going to do is, I was just in my local hospital, and they said, we're going to transfer you to the QE in Birmingham. And because I have the Teenage Cancer Trust unit, and because of my age, they said that was where I'd be best treated. So there was no, I think from the point I was diagnosed, I didn't go home for 5 weeks.
Wow. So I guess both of you there are on what, if we looked at, you know, a line in terms of different types of diagnosis, both of you are quite together at one end of an extreme diagnosis, and you've had to process things quickly and put things in, make them up yourself to be able to cope, and then not knowing how to and not having the time to. Quite a different experience to somebody that's diagnosed perhaps with a chronic condition, where that diagnosis is a process over time. So maybe I could talk to that, and there's the next question that has actually come up from that. And I think if we could, if I just pose that, and then if we were able to, if possible, if we were able to look, are there strategies that can help us as a family and as individuals in going through that initial shock stage in terms of, and I'd like to then reach out to you, Jasmine, and Kirsty on that. I mean, I could share, but I could also share where the question is here, is the diagnosis process for chronic condition can take a longer period of time. So you get to hear the likelihood that you have a diagnosis of a leukemia, but that's never confirmed, and you have to keep going in. And diagnosis in this instance was, how can somebody cope with the fear of going in for their test results during the process of diagnosis? Because at that moment, life was just like walking in treacle, unable to function. And, you know, from that point of view, the diagnosis was a bit of a drawn out affair. So the shock was immense. I could resonate with you, Sam, as a parent. My greatest fear wasn't about myself. My fear was about how the hell do I talk to my kids about this, and how do I talk to the family? And the grief thing hadn't crept in that Jasmine's talking about there, but life expectancy and what your plans are and everything else is changing. That shock is the hardest thing to overcome, and so much gets bottled up and then comes to bite you later, perhaps, is what you're saying there, Sam. So I'm just wondering, are there tips and coping strategies that as healthcare professionals and patients we're able to share to help with coping? I think you talked about sort of use of the emotional regulation system, and somebody else's teachings, Jasmine's, but for those that might be on the call that have just been diagnosed, or for those that might be watching in the future, have you got any practical advice to help with overcoming shock? And the other thing as well that resonated in this was, and Samantha brought it up, was fear. You know, that constant fear, that constant being on broken glass, being on eggshells. How can you cope with the fear? Because obviously you're dealing with that uncertainty, you don't know, but all you've heard is leukemia, world ends, and you're living with fear for that confirmation. So sorry to draw out the question, but dealing with that first shock, and it was you, Sophie, who said that you feel that if people can start off in the right way, knowing where there might be next steps coming. Jasmine, have you got anything that you could offer here?
Yeah, I mean, I think it's giving those feelings some attention. So it's kind of, rather than saying, brushing them away and thinking I shouldn't be feeling fear, you know, get rid of it, distract myself, you know, kind of acknowledging that you do feel fearful. Talk to people who you trust. I think sometimes that means talking to family, but sometimes it was talking to the healthcare professionals about it, because it's quite easy to want to protect family. So it's quite difficult to sometimes share those really difficult feelings. So I think giving it some sort of kind attention. It's understandable that I feel afraid, but also going back to what, you know, we were saying about the soothing system. So you've had this threat. So in the short term, it's about things that will soothe you. So thinking about what normally for you as an individual makes you feel calmer. So for some people that might be, you know, some calming music. It might be having a warm bath, or you know, having some snuggly blankets brought into the hospital, things that are literally going to sort of calm down the nervous system. It might be talking, but it might not be talking, you know, so that depends on how you feel. Some people feel better from being able to share their emotions and others don't. So I think, yeah, and then information can help, but it can also be too much. So it's working out how much information you want at each point. So for some people, Googling trusted websites, you know, like Leukemia Care or Macmillan will be a helpful thing, you know, to find out information that's reliable. And talking to healthcare professionals. I wouldn't advise just randomly Googling, because that can add to the sense of threat, of fear, because you might get stories up that are not, you know, not that helpful. So it's just trying to find out how much information any individual wants at the time. So
information is the best alleviator of fear. If you can get the right information in the way it would help you, but not understanding the information you need, it's a difficult one, isn't it? Because at diagnosis, how many of us go deaf? You don't take a lot on board, do you? I'm wondering what you have to offer there. Thank you, Jasmine. That's really helpful. Kirsty, have you got anything you could allude in this area?
I think that's a really hard one, because regardless of how hard you try, there is going to be a fear element, because it's that fight or flight. You are in fear of what's going to happen. And particularly with haematology diagnosis, again, it is the most, I wish we could take a sample of blood and we would know exactly, because a lot of the time it is a lengthier process than some other cancers, and that there's not a lot that we can do to alleviate the fear. I think what we have to be able to do is to let people know that we are there to answer any questions that we can at that time, but also to be honest with people, and not try and downplay the fear or that feeling of uncertainty, and give people time. So, you know, I get quite frustrated that patients' appointments are 20 minutes. You know, I feel as though a patient should be there, particularly when you're going through that diagnosis process, to allow you to be able to ask the questions that you want to ask those silly questions. I'm the queen of stupid questions, stupid things I worry about, the big things that I'll deal with, but it's the silly things that niggle away and that keep me awake at night, and I should just ask about them. And sometimes if it's a fear, if you ask, is then out, is then not rattling about. And even if you don't get the answer that you want, it's out there and it's been dealt with a little bit. So sometimes it is just facing that, being able to say that these clinic appointments or the healthcare professionals, I think Sophie and Sam have demonstrated there's different ways of dealing with it. There's different ways of giving diagnosis, as I take note what not to do. But it's also everybody's different. So we have to be able to allow people that space to verbalize what they want, whether it is information, whether it's I don't want a lot of information at the moment, I just need to know bits and bobs. And a lot of what I do is, how do you like information? Because I'm a visual person. You give me a booklet or a pack with lots of written information, that's not going to get opened. That's going to be put to the side and left to gather dust. So all I normally ask patients is, how do you like information? Do you want the salient points to begin with and let you process them? Do you need time? Do you want lots of stuff and then time to come back? And it's just being able to say to people, how does this going to process? How can we help you start that process? So I don't think we can ever take away the fear. I think it's just saying that we know that it's there, so speak to us about it, and we'll do our best we can while we're in this limbo period of being able to help understand why things take so long. Because I think if sometimes people know the whys, it just helps a little bit in that process.
Thank you, Kirsty. Yeah, I've got a question here about, similar is somebody finding it hard to adjust to the idea of being told they have leukemia, which I can resonate to and others can, and not really able to look at the information and talk to about others. So is that normal? Is that a normal experience?
Totally normal.
Everybody's
totally, and everybody's, yeah, and I think that's the thing. Nobody can say for certain how they're going to go into this experience. I've said, doing this for so many years, I still wouldn't know how I would be. I think I would be a wreck. And I think you just have to give yourself time, and you do. A big part of it's allowing the diagnosis to sink in so that you can process it for the impact on you. And, Sam went straight to defense mode almost, and right, I'm going to be practical. And there's nothing wrong with that. And you would maybe do that again. That's just the way some people are. But then it is accepting that will catch up with you as well. So you have to be able to balance it. And if you don't balance it, it goes wrong. We're there to help scoop up and put the pieces together. So nobody is going to accept this diagnosis and go, okay, that's fine. Life goes on, because life doesn't go on. Life is going to change. You have to process that. You have to reflect on that, and you have to have that time to do it. And that's normal. It's absolutely normal.
Yeah, I would agree with that. I think that sort of feeling of not wanting to take too much information to start with is often like a protection mechanism, which is okay, and it's just kind of going at the pace. Yeah.
It resonates with me from myself, and I see Sam and Sophie nodding their heads there. One of the questions we talked about earlier about positivity and about feelings of not being able to be positive and low mood. Is that an okay feeling? I mean, there can feel to be a pressure of being positive, and as definitely Samantha was saying there about being positive for her kids and everybody else around there. What would you say to the feelings about somebody that is just finding it impossible to be positive? Is there and then I guess that leads on to another question is there a stage when that your emotional feelings have got to a level where that you might need to actually speak to somebody to see if it is purely just down to the diagnosis as well? But the main thing is, is it okay not to feel positive?
Yeah, I mean, I thought that Kirsty's analogy about the duvet was really helpful in terms of when to sort of get referred. So I think that being positive means being able to do some things. So if you're going for quite a long period of time and not, for instance, not eating, not drinking, or not getting up, that kind of thing, that would be an extreme example of not being sort of positive enough. But I think sort of gently challenging difficulties is being positive. So, for instance, what I mean by that is noticing maybe that you don't really want to get up, but being kind to yourself and saying, well, just get up for a few minutes, have a wash, and then you can go back to bed. You know, trying to sort of make things a bit more manageable is a way of being positive in a sort of a little bit of a gentler way. I don't think, I mean, the evidence there isn't the evidence out there that a sort of a positive mindset as such, sort of saying, oh, I'm going to be fine, makes it better, makes the outcome better or not. There isn't evidence about that. So I think being positive probably means doing the things that you need to do. I don't know if that makes sense.
Yeah.
I always say, I probably worry more about my patients who are 100% positive all of the time, because they're not dealing with this. Mm-hmm. You cannot, in life, we cannot go being 100% positive all of the time. We have our days where we feel low, we feel hormonal, we feel whatever, we have bad days. So you just can't have days where you're 100% positive. And if you are, you're on my radar for worrying about, because this will then come and catch you. And I think feeling low is normal, and talking about it is normal. And there are loads of things we can do, and it doesn't necessarily need to be starting on antidepressants or tablets. It's getting like psychological services like the Jasmines of the world to come in and just talk about it. It can be running. That's my therapy. And my mood is, if I don't get out for a run, I say that's my therapy, because I know that impacts on my mood. If I've not been out for a run and been able to process my stuff, I know I can watch my mood slide. So we all know our triggers. And just because you're going through this doesn't mean that all of a sudden your mood is going to change. If your mood has been low for various different reasons, this is just going to impact on it. But we're here to help with it, and you have to speak to us about it. And to get on my soapbox slightly, and if we don't have a Jasmine equivalent in the hospital, we need to sort of talk about that as well, because that's a vital part of this sort of treatment, is dealing with the physical and dealing with the mental. And some healthcare professionals, some of us can do it, but some of us know when we're out of our depths and needs the Jasmines in the life to come in and be able to support that patient as well. So I think being low is normal, and is probably more normal than being positive all the time.
Thank you for reflecting on that, Kirsty. So communication sounds to be key in this. And obviously in the ideal world, if you had limitless time and all, as key contacts, as clinical nurse specialists, you would be there to take a call at a lot of the time. I guess it's an ideal opportunity to look at what the charities can offer and the importance of talking to charities. Because I know when I was diagnosed, I was given a card for lymphoma action and just drop a name. And I thought, I don't have a lymphoma. I have CLL, which, because I knew nothing about, I'm not going to phone them. I didn't want to talk to anybody at the time. But obviously, when you do talk to others, you can talk to people that. So maybe, Sophie, you're the person to ask this question, is what can the charities do to help fill that gap? Sometimes if the patients can't actually get, because that's part of the challenge. Sometimes some trusts are better than others at providing clinical nurse support that are available on the phone. What can the charity offer?
So sometimes it's all about finding the right person to speak to about everything. So as a patient, you don't really want to put things on your family because you don't want to upset them. You don't really want to say a lot to your doctor because in the beginning, you don't think they probably, you think they don't really have enough time for me to talk about these things. So the charities are there really like to offer that sort of, you know, that voice on the other end of a phone or on the other end of, you know, a WhatsApp message like I do for Leukemia Care Now. And it's just knowing that there's someone there who cares about you and your situation, and they're there to listen, even if you don't, you know, even if you don't have a specific solution that you want them to help you solve. It's just about being able to sort of sound off, get everything off of your chest. And it's that automatic relief of having shared it with someone and sharing the burden. And I think a lot of the time that's what people need. So Sam and I are very active in, you know, the online blood cancer community. And I feel for me, that was one of the ways that I coped in the beginning. Like at first I was like, I'm not putting anything on social media. I don't want anyone to know what's going on, whatever. But when I did start to put things on there, I started noticing that, you know, I was getting these interactions from strangers who I didn't know existed, and when actually they knew exactly how I felt. And I suppose in a way that's exactly how the buddy system works, like with Leukemia Care. Like we can put you in touch with someone who's in a very similar situation, who you can say, oh, I've had this today, or I've been told about this, or I've got this side effect. And it's all about normalizing how you're feeling, and someone else saying that's okay, like I've had that as well. And it's just having that relief of sharing it. And, you know, and that's why the charities are so important, and the support is there. But sometimes, unfortunately, patients don't always know about us, and that's why it's so important for, you know, healthcare professionals to share what they know about us and the things that we can do. And that's our ultimate goal, to get everyone who's diagnosed with blood cancer in touch with us, so we can get them the support that they need and that we know that they need.
That's really great summary of what you can offer and what the charities. And I think maybe just building on that slightly, the peer support element, you know, supported by those that have experienced and are experiencing what you're experiencing, and can share and help you through those stages, is really important. And there's now an army of people online in these good support groups that are run by reputable charities across the different leukemia types. There's good practice that the patients use when they're sharing information, and they're there to help people when newly diagnosed, because to all of us in advocacy, newly diagnosed people are the people we want to help the most, because we know what it was like to be, you know, not have that information. So yeah, I can't impress on people enough. Don't be there in the dark. If you can't connect with your healthcare professional, please connect either with helplines, support lines with your charity, or use the digital experience. You know, there are opportunities for Facebook where you're not going to be anonymous, but in closed support groups, or there are opportunities to be anonymous within an anonymized group. So thank you for sharing that. Samantha, have you got anything to add in that area? Because that's an area working.
I do. And I mean, my first experience of connecting with another patient was the fact that I was diagnosed around the same time as somebody who had lots of mutual friends with me on social media. And we were put in touch with each other. So she was in her room and I was in my room. And she kind of gave me the heads up on lots of things, like the procedures that I was going to have, who to get cheese and crackers from at midnight, you know, just it was just a real heads up on everything that I needed to know. She was my go-to girl, because, you know, I was a newbie. I didn't know any of the staff really. I didn't know the routine of the day, or, you know, I had no idea what was to come. And she really set me up, and I, you know, we're still great friends now. And you know, she was invaluable, absolutely invaluable. And then during my treatment, I met a couple of other ladies. One happened to be the cleaner in my room, and another one used to come in and give like massage therapies, both of whom had AML, both of whom had stem cell transplants from siblings. So I kind of felt prepared. They were the ones that I spoke to about everything and anything. And, you know, if you have any questions, it doesn't matter how stupid you think they are, ask us. And without them, I would have been in the dark, to not put too fine a point on it, because I wasn't given information really I was told not to Google, and that was about all. I was given a booklet from Bloodwise at the time, which I didn't want to read because I just thought, I don't think I want to know. All of my information was given to my daughter, and she'd annotate it for me. And she'd say, right, Mum, this is what you need to know. Just read the bits that I've highlighted. And that was basically how we went for quite a long time. And then I came out of treatment, and I found that because I was in this community, people were then messaging me and, you know, I've been diagnosed, somebody else I know has been diagnosed, or they're going through this, or they're going through that. And I started to reach out to the online community. And now, like Sophie says, we're both quite big voices in that community. And it's great. It's fantastic because we've tapped into different charities. I work now with lots of different cancer types. So I'm collecting information all the time, different signposting and things like that. And just the peer support means so much to patients. It really does. For someone to say, I get it, you're not on your own. And, you know, it's perfectly normal to feel like this. And, you know, don't ever feel that anything that you're going through, you're the only one. You're not. You're really not. And if you want to lean on me for anything, you can. If you want to have a cry, a rant, a rave, anything, because you can't really do that with your family. So if you want to pick up the phone and say, look, I just really need to rant about this, or I just really need to have a cry, do it. Call me. I will just listen. Or I will just be on the end of the phone going, it's okay. It's going to be okay. It's just, I really do feel the value really is in the peer-to-peer support system. It's something that I believe in.
You've taken a lot of words off the tip of my tongue in terms of questions there. And I think another thing that the peer groups can offer is obviously the disease-specific groups can deal with some of the anomalies and different challenges that you might be presented, that peers in those groups have been through and go through that with you. And there is very much, we're getting better at it now. You know, we've got this harmonized approach now with the healthcare teams, and we're getting better at being connected via the healthcare teams. But I made a mistake earlier. It wasn't so much a mistake. Two people have mentioned that they had chronic diagnosis, and they were actually acute chronic diagnosis because both people needed treatment straight away. So they didn't have a lot of time to react. And that's where that information gap is, isn't it? And is how do you connect? So I just wanted it, if we could, we talked about the support network. You know, who can be part of that support? And we've identified that that obviously there are charities. Charities are offering that support. Your healthcare team, your clinical nurse specialist. How can you connect with a support group? And we're going to have a webinar about talking to others. There are different, you know, one of the greatest challenges is being able to talk to others. I reached out to a charity myself in the very beginning. The only reason I did, because I was trying to be brave and tough it out, was I just didn't know how to talk to my daughters, and I wanted some advice how to do that. But how important is your support network? And I throw that first to Jasmine and to Kirsty. And who can you involve? Who can help? Not just obviously the charities, not just other patients, not just healthcare professionals. Who's important to you in that? And then have you got any advice in talking to others?
Yeah, I mean, I completely agree with what you're saying about the peer support. They've just started in Swindon it's Macmillan personalised care service, where they're doing a pilot scheme on buddy support. So previous patients are buddying up with current patients, which seems to be going really well. I think what people have said already is about choosing the person or the people that you feel the most comfortable with. And that may be professionals, but it may be a really good friend, and it might not be the friend that you would have expected to be able to talk to her about it. You know, just because somebody's a really, really good friend, they might not be the best at this situation. So sometimes can be surprising who are the people that you want to talk to. In our hospital, you can be referred to the cancer psychology team. So there's myself and two clinical psychologists. So it depends on the level of support that's needed, who you'd be referred to. Macmillan also they've teamed up with BUPA, And so you can get counselling, 6 sessions of counselling through that, which is all free, and there aren't huge waiting lists as well. I think different hospitals have different levels of formalized psychology, so it just depends on which hospital. Sometimes depends how well people are, but sometimes, perhaps a bit later on after diagnosis, people joining gentle exercise groups. I know in Swindon they have things like Steps to Health, where people do, have walking groups or different levels of exercise, because sometimes people feel more comfortable doing something while they're talking. So that's sometimes why counselling isn't the right thing for some people, because sitting sort of face to face with somebody might be too much. So whereas actually doing an activity, so the personalised care team do sort of different talks and things on managing things in different ways. So just looking at all different ways and seeing what has worked. If things haven't worked, then not feeling that you've got to go back to that same person. So for instance, if you went to a counsellor and you didn't feel there was a connection, it's absolutely fine to not go. Or the same with a friend, if you said, right, we'll meet up and talk about things, but you didn't find it helpful, then maybe trying something else. Not feeling that you've got to be stuck in one particular model or mode.
Thanks, Jasmine. That's really helpful. Has anybody got anything they'd like to add to that?
So I think there's no defined support network. It is whatever you need to help get you through, and that can be adding people in or dropping people, or it can be dogs, it can be horses. Some people don't relate to humans. I had a lady, it was her pack and it was dogs, and that was what she needed. She needed to be able to just go get out with her dogs and then come back. So it's whatever works for that person in that situation to help them get through. And it's not a solid thing, it can be a fluid thing. And I think it's when you find out a little bit more about yourself and what you need, because for some people it must be the worst thing in the world to be able to come to sit down in a group of people and talk. That's not their thing. There'll be other ways. So again, it's finding out what works. And if that doesn't work, doing something else. Is it mindfulness, where actually you can then shut your body down and process things, so it doesn't need to be somebody else, it's just using what your own body. So I think your support network is whatever works for you, and also whatever works maybe for, because a lot of this, the diagnosis isn't just the person, there's that ripple effect, and that's the thing. I think another big thing that's changed is that there's so many good charities out there that pick up the gaps that we can't as healthcare professionals. There's so many patients, chronic and acute, we can't possibly see everybody, and that's sad. That's a sad reflection of the NHS today. But actually, there's these brilliant pockets of light that are the charities that people can go to, and then they can pick and choose what they need, whether it's counselling sessions, because Leukemia Care do that, whether it's buddying, whether it's online forums, whether it's blogs. So it's whatever works for that person and that family, that unit, to get through.
Thank you, Kirsty. I'm mindful of time and moving on. Maybe that's a good idea. Diagnosis isn't just a moment in time, is it? It's the beginning of a journey. And things change, you change, you'll begin to live with the condition and live with some of the challenges you've got to overcome on the way. So I'm just wondering if we can maybe talk about that now, talk about next steps, emotions you're going to experience and support needed when you're going through therapy or living with long-term prior to therapy, or if you're not being treated. I can add to the point there that the support services, your CNS, your haematology is, and if you have a curable leukemia, you are going to be able to company at some point if you have an incurable, but even as a survivor, you're still there. So your support groups aren't just for that moment in time of diagnosis. If you're able to and you're not already connected with peer support groups, that might be virtual support groups, that might be local meetings. They're there with you during that journey. Sam pointed out there about friends that you've made. Diagnosis can open a lot of doors to you, and it can actually help you to meet those, meet people, and they'll help you through that journey. I think what I was going to ask is if you've got anything to share, how you feel now, because I think what I want to do is get the message over to people that are newly diagnosed. It does get better emotionally, and you do learn how to deal with things, and part of that is the help and the relationships you build with others. But we've got two great examples here with you, Sophie and Sam, went through traumatic diagnosis. Diagnosis is very isolating. It doesn't need to be isolating, and living with the condition doesn't need to be isolating. And COVID's not helping at the moment because we're isolated. So I'm just wondering if I draw out my rhetoric sometimes. Apologies, Sophie, say something.
All right. Yeah, I mean, I think for me, like from that initial moment of diagnosis, like as the days move forward, you do slowly start to process it, and it's very different for everyone. It's very individual, but a way that I used to cope was just sort of, and I still use this now, but it's just sort of, going day by day, taking one day at a time, and, find something good that made you smiling every day. And if you are having a bad day, just acknowledge that, and it's okay, because, tomorrow's a new day, start again sort of thing. And that was a massive way that, like, myself and my family used to go through things. Like, my dad used to come up and visit, and we'd say, oh, not a very good day today, and try and cheer us up with some food that I probably couldn't eat, but you know what I mean, like the thought was there, and those little things, like, they all make a difference. And yeah, I think definitely when you're going through it, it's just about sitting back and giving yourself the time and the time to process and to actually heal yourself as you're going along, and accept that there will be bad days, and it's just normal to feel that way. There's nothing wrong with you, like, in that sense. Like, it's just part of the motions that you have to go through when you're diagnosed.
Any triggers, anything that, obviously you've got, like, we could use words like lumps in the custard, bumps in the road that we have to navigate. I often use those as a way, but are there anything that, triggers change? Have there been pivotal moments in a journey where?
I think it's something that you just reflect on as you go along. I think sometimes you don't realise that a change has happened until you look back on it. A long time later, you might not think that you were coping well at the time, and when actually you think, God, how did I do that? Like, you don't even realise. You just go into this, this defence, and you might think, I'm doing really badly, like I'm not handling it well, when really you're doing amazing, and every step forward is just, it's a step in the right direction. And again, just letting yourself feel the emotions and going through it, and telling yourself that it's okay to feel like that. And if you need to tell someone, then don't keep it to yourself. Don't struggle on your own.
Sound advice. Thank you for sharing. Samantha.
Agreed, absolutely agreed, 100%. I suppose, well, Kirsty actually said this earlier on, it's not linear. It's an absolute roller coaster. Yeah. And I consider myself to be quite a strong person. I have a fairly large personality, and I take up a lot of space, and and I'm unapologetic about that. And I kind of find that along the way, I've been silenced a lot, because I'm just like, oh, okay, didn't realise that I couldn't cope with this. Didn't realise that this was going to be as hard as it was going to be. And and it's taught me a lot about myself. It really, really has. I've got quite a lot of late effects from my diagnosis, and both Sophie and I will be under the care of our team for the rest of our lives. That's how it's going to be. We'll never be free. And so I suppose because we're so far on, we have these coping mechanisms in place when we know that we're going to go for our bloods ready for our appointments, and and then we have to go to our appointments, and that might flag up a couple of issues, and we might have to go for an x-ray or something like that. We've learned to manage that. We understand that we're not in the place that we were in before. We're further along now, and anything that could go wrong maybe will be flagged up very quickly, and they'll be on it very quickly. So we know that, and we have, it's comforting, I think, personally. I always know that I've got someone I can rely on. I know that I can always pick up the phone. My CNS is the most incredible person ever. She is an absolute goddess, and I could not live my life without her. I know that any time that I have any concern, and it doesn't matter, like Kirsty said, how inconsequential it could be, I will just ask the question and she will come back with an answer. And it's just really, it's helpful to know. But my life goes on, and you do have bad days, and you just crack on with the bad days and think, okay, it's not always going to be like this. This is not forever. Everything is temporary. And then you enjoy the good days when they come along, just that little bit more because of what you've been through, I think.
I'd agree with that.
You can't go through what you have been through without coming out at a different person. It's almost like you've come out of a cocoon. You've come out as butterflies with a very, very different outlook on life and you as a person. And I think that's one of the biggest things that will happen. And I always say, once a haematology patient, always a haematology patient. And we very rarely discharge people simply because haematological conditions are longer term. We're living with them longer, we're managing them longer. They might start off acute, but they become more chronic. So you're always a haematology patient, and there's always going to be those triggers. And we will always then try to be there to help. If there is a trigger, if there is something wrong, put it into perspective or give you the information quickly. So I think regardless of the diagnosis is always going to be there, and it's going to be part of you, and it's like a chronic condition that rather than at that stage of diagnosis where it controls you, you are now more hand in hand with it, living with it. And there'll be times where it's maybe got the alpha in you, and then there'll be times where it's just at the back burner, but it's part of you now. That it's part of your jigsaw of life, and that's it's learning to accept that but not let it overwhelm you.
Yeah, it's taught me that I can do hard things. I think that totally came through the whole way through, thinking actually I can do hard things even if they're really, really challenging. I can do this. I am strong enough, and I'll get through it somehow. And you do have, sometimes you have unhealthy coping mechanisms. I might eat a lot of chocolate before I have my appointments because it's comforting.
But it works.
But my therapy is music. So if I feel like I'm going down a dark road, I start putting on the music that I used to listen to bring me out of my bad days when I was in hospital. Music is therapy.
Agreed.
So it is a big adjustment to have to make, isn't it? And it's very hard to put into bite-sized chunks as you have to deal with it at that moment in time. But I mean, there was a question earlier, and somebody that's been diagnosed has kindly asked because they have comorbidities and issues, chest issues, and having to, how do you balance the question was, how do you balance the diagnosis and living with the diagnosis and with the other issues, and where do you find that risk in yourself? That when do you become comfortable again in your own skin is a varied thing. I was going to answer to that person. I don't know how you feel about that. It takes a bit of time to be comfortable again in your own skin, to find your limitations and pick the bones out of what's the diagnosis emotionally and mentally, what's the physical, and COVID hasn't helped for us all at the moment. I'm just wondering, were there pivotal moments for you, Sophie and Samantha, when you felt whole again? Or is it a constant battle?
Yeah, I mean, I wouldn't say you ever really feel whole again after your diagnosis, because that, you know, that part of yourself has been taken away, and it doesn't come back, but you rebuild in different ways. And you know, it's not a race. Like, you don't have to rush. One of my things was that I was obsessed with, well, I need to get back to university, I need to go back, because all my friends were going to graduate and I wasn't going to be there. And that was a major thing that I used to think about. And like, to me, you know, everyone's got their own priorities. To me, that was really important to me. And, you know, over time, that sort of, you know, that feeling of missing out and losing that part of myself, it does, you know, relieve. And I remember when they'd finished their exams, I was sitting in chemo and I sent them some shots from spoons through my phone. Like, you know what I mean? You just do little things to cheer yourself up, and you know, it comes with time. It's about not rushing yourself, and like I've said earlier, just letting yourself feel that way. And if you are feeling bad, it's okay. Like, it's normal. You've been through something so traumatic and you're still going through it. And you know, I always say to everyone at work, like, don't mind me when it's coming up to, you know, when my appointment's due, because I just get really anxious, and you can't help it. It's just there. You always can't help but think those things. But again, it's about normalizing it, and to normalize it, we need to speak about it. So yeah.
Well, I'm mindful of time, and I've got a few slides that we'd like to share, and I'd like to thank everybody for, but you know, from summarizing that diagnosis isn't just diagnosis. It isn't just the act of diagnosis and being told that you've got a condition and then having to go through whatever the therapeutic actions are. That's with you, and so are those that support you, both as your care team and the peers that you can meet, and the peers that will support you in the beginning. And it's an ongoing journey together. So that what I'm getting from this is there are now a wealth of resources. There are ways to reach out. You don't any longer have to be isolated and alone with your thoughts and your fears and your emotions, or with the weaknesses that the condition gives you. And if anything's taught us that, COVID has really exacerbated that for us, and it's another topic altogether. But I'm just wondering, I've got some shared slides I'd like to share of some supportive resources that we alluded to early on, but just as a quick roundup, can we just do a quick round robin for everybody if they'd like someone? I apologize if we haven't been able to answer everybody's questions, because they've kind of been answered in a way by everybody. But I think my parting shot was, you know, if you have an opportunity, for me as a patient, my eureka moment was when I met my first other patient living with the condition, and they got it, using Samantha's words. And you know, don't feel afraid to reach out. Don't feel afraid to get in touch with a charity, to keep in contact with your CNS, join a support group, you know, think about being a buddy, and connecting with somebody who knows. That's my parting word. Samantha, let's go to you first.
I'll say that connecting with others is probably the best thing that you will ever do, because as soon as you connect with that very first person, you'll never be alone again. You'll never be alone. You'll always have someone to speak to that completely understands.
And you grow together. And
you do grow together, and you go through many things together, and you celebrate each other's wins, and you're there, you know, if you need a bit of a cry. But most of the time it's about celebrating the wins, I think.
Sophie, to you, about the club that nobody wanted to be a member of.
Oh, definitely. No, I mean, for me, it's just, my advice would be just take it one day at a time and look for all the little things that make you smile throughout the day. And if you do have that bad day, it's absolutely fine. And, you know, like Sam said, celebrate the little wins, the tiniest thing, you know, make it a big deal. It's a big deal to you. So, you know, why shouldn't you celebrate it? And yeah, and just reach out to anyone. The charities are here for you. We're here for you. So yeah, you don't have to do it on your own.
Thank you, Sophie. Very well put. Sorry, Kirsty or Jasmine, apologies, I'm looking at slides at the moment. I'm not very good at multitasking. I'm doing it though.
I think for me, I would say just try to be as kind to yourself as you would be to somebody else. Sometimes that sort of critical voice of I should be doing this, I should be doing more, or I shouldn't be feeling this can be quite hard. So just trying to be as kind to yourself as you can.
100%. Be kind to yourself, because nobody knows how this is going to go, and everybody gets stuck at some point. So ask, be kind to yourself, allow yourself to be in that place and ask for help to get you better and to get you through this.
Thank you, Kirsty. I'll put some slides up now just to run through at the end. And listen, thank you as a panel for coming together. It's been really insightful listening to everybody. And obviously, the slides coming up will share information. You've already given great information. Thank you, everybody in the audience. And, please keep in touch with your peer groups, reach out for information. I'll share the information resources now. And thank you, everybody on Facebook. If I can manage to do this, apologies. Can you see those slides?
Yeah.
Excellent. So I'll run through some services available from Leukemia Care. Information is God. How you assimilate that information and how you want it might vary, but Leukemia Care provides a wealth of information sources, as do other charities. Webinars you're aware of, we're here today, so we have newsletters which are on a quarterly, actually more frequent than that. The magazine's quarterly, newsletters seem to be coming out every month. They will keep you updated with information, patient stories, connect you with other patients. We've got a great podcast service as well. Charlotte runs the podcast service, and that's a really great opportunity to learn from other patients what their experiences and how they've overcome challenges. So I would recommend dipping in if you're somebody that likes to listen to something whilst they're doing another activity, which was something that Jasmine mentioned as a possible way of coping. Very active on social media. We've touched on that, and the website. I'll look at some specific items. Our next webinar might not be relevant for you if you've just been diagnosed and you're not likely to need treatment, but at some point in your journey it may be. So our next webinar is on the 5th of July, and it's aimed at helping you empower patients to have more of an idea and remove some of the mystery about clinical trials, to feel a bit more empowered about decisions you would need to make if you were, if joining a clinical trial was to be part of potentially your future. And I think, Sophie, you're likely to be one of the panelists on that, so looking forward to that. And you can find information about that on the website and register there. Podcasts I've just touched on, excellent resource. I like gardening. I love listening to a podcast while I'm doing something. Information booklets. Information is key. We've actually worked as a charity to reduce the volume and the amount of information in, so that you can actually, in bite-sized pieces, get more chunks of information. So we've got an excellent booklet, for example, on the emotional impact of living with leukemia and the diagnosis of leukemia. So you can access there on the website through, and there's a series of booklets that might be more disease specific for you as well. So please drop onto the website and have a look. I mentioned our quarterly newsletter, and there's a lovely picture of our celebrity champion who's just joined with us. The next one's actually just come available, I believe. Sophie, you know about that. Is that now available, the summer edition?
Yeah, the summer one's now out. It's very good.
You can access that if you register that and give your preferences. You'll automatically receive that from the charity. Other support services. Sophie alluded to the helpline and the WhatsApp. I've never tried a WhatsApp helpline, but I use WhatsApp a lot. It sounds fascinating, but it's a great way to connect quickly. WhatsApp drives me nuts. I wish it's always on the go. It's always there, isn't it? Virtual support groups. I've got a list of some virtual support groups coming up, but Leukemia Care, we've got a network of around 50 local support groups. Some are disease specific, some are more generic, but they're a great opportunity to be able to either meet people virtually or face-to-face. And that's the beginning of your empowerment. Learning from others is without a doubt, and growing together is one of the most supportive ways of dealing with things, so you're not on your own. We have a welfare advocacy officer, so welfare advice is really important, and especially in this climate, because obviously a diagnosis can impact on your income, could interfere with your job, and on top of everything else, living with a leukemia can add some financial burden. So please don't be frightened to reach out. And you can contact our welfare officer for advice. At that moment, my computer has put a screen in front of me. Advocacy support. Well, you've met Sophie. There's a group in the team, but Sophie and team are there for direct connection. Online forums we've talked about. We run Facebook groups and the buddy scheme, which I'll touch on in a moment. And we also do offer a counselling fund, which I'll come to now. So this gives an idea. We're also now running national meetings that are disease specific. So if you're in a particular, if you have a diagnosis of a particular type of leukemia, you don't have to feel that you don't fit in with other groups. There are disease-specific national meetings. So here's an idea of those that are coming up over the next 2 months. And if you're not on that list, the rest will be coming up for you. Plus these mix in with the local meetings. So if you drop onto the website, you can actually get a menu and a calendar of what's coming up available. The other thing, the buddy scheme. Now, Jasmine talked about buddy scheme. We've been running the buddy scheme for the best part of 3 years, and it's phenomenally successful. And quite often this can be a long-term thing. So you might have, if you want to help somebody else, you can register with Leukemia Care if you want to buddy somebody else and share and pass forward your experience and help them through. And if you want to buddy, contact Leukemia Care. Now, we've now introduced a short term where you can get to talk to somebody pretty much immediately. So it's a short 6-week buddying scheme where that can take some of the sting out of the emotional crisis you might be going forward. So really recommend that, and please do get in touch with us if that's something that might help you. Advocacy Caseworker, we've just been talking to you. And our welfare officer I've just brought up, so apologies, slides are repetitive. The Anne Ashley Counselling Fund, we do offer, similarly to what was mentioned earlier, up to 6 sessions of counselling if you're affected by a diagnosis of a blood cancer. So that doesn't mean just in treatment, that can be at diagnosis. And if you're finding it hard, then please get in touch. We're organising our first conference since the pandemic started. Now, this is a hybrid gathering. So if you're immune compromised and you feel that you're not ready to be in touch, in the same room with others, you don't have to be. You can join the conference and you can attend virtually. The sessions and all activities will be streamed to you. But if you are of a mind that you want to connect with others, I really recommend joining for the day. It's an opportunity the event's bringing the family together, all of us as supporters, everybody that's been playing a role to help each other, as well as, even if you haven't, it's a way for you to come and meet others. So that's the 13th of August. It's an all-day event on a Saturday, and it's at the Mercure in Birmingham. It's really easy. It's an obscure place, but it's a really easy place to get to if you're traveling by car. I wouldn't rely on the trains at the moment. Fundraising, it's a difficult thing to always, to bring up when we're talking to each other as patients, but obviously we have to be able to fund all of the support and services we offer. So, if you're interested in picking up fundraising activities, please do drop on the website and can have a look at activities that are quite simple to carry out that, you might be able to, they can also be that can also be a way of coping with some of the emotional issues you might have. It's something to do, something I've often been involved in. So please drop on the website and you can find what type of activities might suit you if you wanted to do that. This is for the really ambitious. Those that are just newly diagnosed, I wouldn't be thinking would be interested in running 50 miles in a month, but you never know. you know, it's not something you have to do in one day. So there's a scheme that's currently running at the moment. And for the really ambitious that might be living with a diagnosis and been living with it for some time, we've just launched our cycle ride to Paris. That's a big fundraiser, and that really will be an interesting expedition. So these are just some examples of fundraisers and fundraising activities we provide. Please have a look on the website, on the fundraising page. You'll find lots of activities where you get to meet others or do, you know, be involved in activities that can help others. Activities on social media, Instagram, Facebook, Twitter, always very active. Please do drop in and have a look and join in the conversation. And just leaving this up there for everybody, don't be isolated. If you want to get in touch, just make a phone call or use the WhatsApp address that's on the website, or use the email address. And if you reach out, we'll help connect you and help give you the information that you need. And I'd like to end there. Thank you everybody for joining us today. Diagnosis itself is a really difficult time. Living with the condition through what comes next does get easier, does get more familiar. And there are points in the road when, you know, reaching out to the charity and connecting with others is really important. And thank you everybody again on the panel for your support and sharing your perspectives today. And thank you everybody for joining us. And I wish you well for the weekend and the future. Thank you for everybody.